Okay, let's talk pregnancy. That queasy feeling.
Yeah.
It's only in the morning, right?
Well,
And you definitely have to eat for two,
hmm
like immediately.
not quite like that.
And those leg cramps at 3 a.m., just need more potassium. Simple as that.
It's often a bit more complex, actually.
What if those are just bits of the story? Welcome to this deep dive. We're, going beyond the surface today. We're
Mm.
really digging into the reality of those everyday, kind of annoying things that happen during pregnancy, moving past the old wives' tales to see what's really up.
Exactly. We've looked at, well, quite a bit of material, including a presentation, minor to get a clearer picture.
Right.
And our goal here really is to empower you, to explain these, minor pregnancy issues, why they happen physiologically,
Now the why.
and crucially, how to manage them so you feel more informed, maybe less overwhelmed, whether it's you or someone you know going through it.
Absolutely. Knowledge is power. Right.
Yeah.
And before we jump right in, a really big thank you to London Heartbeats Academy UK. Their educational support was, well, invaluable for this deep dive. And honestly, if you're looking to learn more, they have over 150 popular courses. Definitely worth checking out.
A fantastic resource.
Totally. And hey, for regular free updates so you don't miss future discussions like this one, make sure you subscribe to London Heartbeats D Academy on their socials, Facebook, Instagram, YouTube. They're all there. Okay, so let's get into it. These minor ailments. What exactly are we talking about? What's the definition?
Okay, so the source gives us a pretty clear definition. The minor ailments of pregnant women that occur due to physiological alterations of hormones and other causative factors which can be managed without medical interventions.
Right, so breaking that down,
hmm
it's stuff caused by normal body changes like hormones.
Yes, the physiological shifts.
And crucially, things you can usually handle without needing, like specific medical treatment.
Precisely. Lifestyle adjustments, self-care, that sort of thing.
That's a key distinction. It's not the serious complications, but the stuff that can still make daily life tricky.
Definitely impactful.
Let's start with a classic one, nausea, sometimes vomiting, that morning sickness thing.
Yeah, it's incredibly common, especially for first-time pregnancies, what we call primigravida.
Okay.
And timing-wise, it usually pops up after the first missed period, maybe the second.
Right around when you find out, often.
Often, yes. And the good news for many is that it tends to ease off by the end of the first trimester.
Phew. And what's actually happening in the body then? Why the nausea?
It's mostly down to hormones. In early pregnancy, you get this huge, rapid surge in hormone levels.
Like HCG?
HCG, progesterone, estrogen, they're all climbing fast. And while that's essential for the pregnancy to establish itself,
Wow.
a common side effect is that nausea, sometimes leading to vomiting. It's the body's reaction, really, to those intense hormonal changes.
Wow. The body's really focused on the mission, isn't it? Even if it makes you feel rubbish.
It absolutely prioritizes the pregnancy.
Okay, alongside the nausea, there's often this bone-deep tiredness, fatigue. It's not just, oh, I had a busy day, tired, is it?
Oh, definitely not. The fatigue in the first trimester particularly can be overwhelming, just complete exhaustion.
Why so tired then? Is it just the hormones again?
Hormones are a big part of it, yes. But also, something called organogenesis is happening.
Organo what now?
Organogenesis, it's basically the period when all the baby's major organs are forming.
Okay. Building the infrastructure.
Exactly. And that takes an enormous amount of energy from the mother's body. It's incredibly demanding work.
That makes so much sense. You're literally building a person from scratch while running your own body. Does the fatigue stick around the whole time?
It varies. Many people actually feel a bit better, more energetic in the second trimester.
The golden trimester, they sometimes call it.
Sometimes, yeah. The intense organ building is mostly done. The body's maybe adjusted a bit to the hormones, but it often comes back in the third trimester.
All right. Why then?
Well, by then you've got the increased weight of the baby, the uterus, the amniotic fluid. Just carrying that around is tiring.
Yeah.
Mobility gets harder, and your metabolism is working harder too, supporting the baby's final growth spurt. So yeah, fatigue often creeps back in.
So different reasons at different stages, but tiredness is a recurring theme. Okay, we get why nausea and fatigue happen, but what can you actually do about them? Because understanding doesn't stop you feeling sick or exhausted.
True. The source offers some practical tips for the nausea and vomiting. One thing is avoiding smells that set you off.
Yeah, triggers.
Exactly. Also, eating smaller meals more often, like 5 or 6 little ones instead of 3 big ones.
Keep something in the stomach.
Kind of, yeah. It stops the stomach getting too empty or too full. And some find eating plain crackers or toast before getting out of bed helps.
Oh, the bedside crackers trick.
Mm-hmm. And generally, steering clear of really greasy or fatty foods can make a difference, as they're harder to digest.
Okay, those are simple things to try. What about fighting that fatigue? Besides, sleeping all day, which isn't usually possible.
Prioritizing rest is key, even if it's just short breaks. Listen to your body. Don't push it too hard.
Easier said than done sometimes.
It really is. Getting enough sleep at night is important too, though that gets harder later on, obviously.
It's true.
And, it's always worth mentioning severe fatigue to your doctor or midwife, just to rule out things like anemia.
Good point. Always keep the healthcare team in the loop. Okay, moving on. Heartburn. Oof. That burning feeling. What's the deal with that during pregnancy?
Heartburn is another one linked strongly to hormones, specifically progesterone again.
That hormone does a lot, doesn't it?
It really does. So progesterone relaxes smooth muscles. That includes the muscle at the top of your stomach, the cardiac sphincter.
Valve, basically.
Exactly, the valve that normally keeps stomach acid in the stomach. When it gets too relaxed, acid can splash back up into the esophagus.
And that causes the burn.
Ouch.
That's the pain, yeah. Acid reflux.
So how do you help that valve stay less relaxed or manage the reflux?
Again, small, frequent meals help less pressure in the stomach. Avoiding trigger foods is big too.
Like spicy stuff, greasy food again. Yep, those are common culprits. Also, drinking lots of liquid right before bed might not be the best idea.
Oh. Why is that?
Lying down with a very full stomach, even full of water, can make reflux easier. Better to drink fluids between meals.
Okay, interesting timing tip. Anything else to avoid?
Well, the source points out that alcohol, which should be avoided anyway, coffee, and chocolate, can make heartburn worse for some people.
Right.
And simple things like staying upright after eating, not slumping or lying down right away.
Let gravity help.
Exactly. And maybe propping your head up a bit with pillows when you sleep.
Simple posture things.
Yeah.
Okay, now another frequent flyer. The bathroom. Needing to wee constantly. Why did that happen?
It's very common and tends to peak at 2 main times. Early on in the first trimester,
Yeah.
the uterus is growing, but it's still down in the pelvis. It starts pressing directly on the bladder.
Just squashing it.
Pretty much. Reduces the bladder's capacity so you feel the urge more often.
Makes sense. Is it the same reason later on?
Oh.
Because it seems to come back with a vengeance.
It does come back, often around week 30 or so, but the reason shifts slightly.
How so?
By then, the baby's usually getting into position for birth, head down.
Engaging.
Right. The presenting part drops lower into the pelvis. And guess what's right there?
The bladder again.
The bladder again. So more pressure, more trips to the loo.
Feels like the bladder just can't win. Is there anything you can do about it?
Honestly, the source says there's no real remedy since it's physical pressure, but you can manage it strategically.
Well-
Like maybe drinking a bit less right before you go out somewhere bathrooms are scarce.
Right.
Or easing up on fluids right before bed to get a bit more sleep.
But still drinking enough overall during the day.
Oh, absolutely crucial. Stay hydrated. Just maybe time it slightly differently if the frequency is really bothersome.
Strategic peeing. Got it. Okay, let's talk about things slowing down. Constipation. Another glamorous side effect.
Very common. And guess who's often involved again?
Let me guess. Progesterone.
You got it. That muscle relaxing effect also applies to the muscles in your gut, your intestines.
So things just move slower.
Exactly. Reduced muscle tone, or atony, they call it. Things get sluggish.
Okay, so if things are sluggish, how do you encourage them?
Management is mostly about diet and lifestyle. Fiber is your friend.
Right. Like what?
Wholemeal bread, whole grain cereals, lots of fruits, vegetables, pulses like beans and lentils, all that good stuff.
Bulk it up.
Yep. And drink plenty of water that helps the fiber do its job. Regular exercise, even gentle walking, helps keep things moving too.
Maintain muscle tone generally.
Right. And one other thing the source mentions, sometimes iron supplements can contribute to constipation.
Well, that's good to know, especially since many pregnant people take iron.
Yeah, so if you're struggling and taking iron, it's worth a chat with your doctor or midwife.
Definitely. Okay, shifting focus. Backache. Seems almost universal in pregnancy.
It is incredibly common. There's a lot going on. You've got the extra weight baby, uterus, fluid.
Yeah.
That shifts your center of gravity, changes your posture.
You kind of lean back a bit.
Often, yeah, to compensate.
Yeah.
And that puts strain on back muscles and ligaments. Plus, just standing or leaning for long periods makes it worse.
It's a mechanical issue, really. So how do you manage that strain?
Being mindful of posture is key. Sitting tall, standing straight, learning how to lift properly, even if it's just groceries or a toddler, is super important.
Bend the knees, not the back.
Exactly. Avoiding standing for ages helps. Gentle pelvic exercises, sometimes called pelvic tilts, can strengthen supporting muscles.
Okay.
And for relief, gentle massage can be lovely. Warm baths, too.
Ah, warm baths again. Sounds like a good prescription. Now, what about those sudden, awful leg cramps? Usually in the calf.
Yes. That sudden gripping feeling often happens in the third trimester and notoriously at night.
Wakes you right up. What's thought to cause those?
The exact cause isn't totally nailed down, but a leading theory mentioned involves mineral levels, specifically possibly lowered serum ionized calcium.
The active calcium in the blood.
Right, and maybe increased phosphate levels. That balance might be off.
Interesting. So if a cramp hits, what do? Besides yell.
Well, yelling might happen. But advice includes avoiding standing or sitting with legs crossed for long stretches.
Keep the circulation going.
Seems to be the idea. And when a cramp happens, massaging the muscle, applying some heat, that can help ease it.
And stretching, like pulling your toes up.
Yes, flexing the foot upwards towards the shin can sometimes help release the spasm.
Good tip for the middle of the night. Okay, staying with the legs. Varicose veins. Some people get them for the first time during pregnancy.
Yes, they can definitely appear then, usually later on. Swollen, sometimes bulging veins in the legs.
And why does pregnancy trigger them?
It's mainly down to pressure again. The growing uterus presses on the big veins in the pelvis, obstructing the blood flow returning from the legs.
Creates a backlog.
Pretty much. Blood pools a bit in the leg veins, causing them to stretch and swell.
So what helps manage that pressure situation?
The source suggests things like wearing supportive bandages, like a crate bandage, when you're up and about.
Compression.
Kind of, yeah. Elevating your legs when you rest is really helpful too. Lets gravity assist the blood flow back up.
Makes sense.
Regular antenatal exercises also promote good circulation. And again, avoiding sitting or standing still for too long. Keep moving when you can.
Circulation seems key for legs in pregnancy.
Yeah.
Okay, changing tack slightly. Vaginal discharge. It often increases, right? Is that normal?
Yes. An increase is generally very normal. It's another hormone effect, mainly estrogen this time.
What does estrogen do?
It stimulates the glands in the cervix to produce more mucus. So you just notice more.
And what should normal discharge look like?
Typically, it's clear or whitish and shouldn't have a strong or unpleasant smell. And it can increase towards the very end of pregnancy.
So usually nothing to worry about. How is it managed then?
For normal discharge, it's mostly about reassurance, letting the person know it's expected, and just good basic hygiene, gentle washing.
Okay. But what if it seems not normal?
Right, that's the important part. If the discharge changes color like yellow, green, gray, or becomes thick like cottage cheese, or smells bad, fishy.
Or if there's itching or burning.
Exactly. Itching, burning, irritation, those could be signs of an infection like thrush or bacterial vaginosis.
And then you need to see someone.
Absolutely. Don't ignore those signs. A doctor or midwife needs to check it out. And if it's an infection, prescribed treatment, maybe like metronidazole or miconazole creams or pessaries.
Okay, crucial distinction there. Finally, let's touch on the emotional side. Pregnancy isn't just physical changes. Moods can be all over the place.
Oh, definitely. Emotional ups and downs are super common. Again, hormones play a massive role.
Disrupting things.
They can directly impact mood regulation, yeah. Making you more sensitive, maybe more reactive.
And all the physical discomfort probably doesn't help either.
Exactly. Feeling sick, tired, achy. Plus maybe anxiety about the pregnancy or birth. That all feeds into the emotional state.
It really is a whole body, whole mind experience. What's the remedy for the emotional roller coaster?
Support is huge. The source really emphasizes reassurance from partners, family, friends, caregivers, midwives.
Feeling understood.
Yes. Having people around who get it, who offer support without judgment, makes a massive difference. Talking about feelings helps too.
And maybe some self-care.
Definitely. Whatever helps you feel better. Gentle exercise, relaxation, hobbies, just taking time out when possible.
So, wrapping this up, pregnancy clearly brings a whole host of changes, physical and emotional.
Absolutely. And many of these common minor ailments stem directly from those big hormonal shifts and the physical reality of a growing uterus.
Nausea, fatigue, heartburn, frequency constipation, aches, cramps, veins, discharge. It's quite a list.
It is, but they're mostly driven by those underlying physiological changes.
And the hopeful part is, as we've discussed, many of them can be managed,
Yeah.
often with pretty simple, practical steps.
Exactly. Lifestyle tweaks, dietary changes, posture adjustments, self-care. Understanding what's happening and knowing there are things you can try can be really empowering.
Takes away some of the anxiety, maybe. Helps you feel a bit more in control during a time of huge change.
That's the goal. And it helps partners and support people understand what's going on too.
This has been really illuminating, breaking down each of these common issues. So a final thought to ponder. We've talked about how the body adapts during pregnancy, but thinking bigger, how might someone's health and lifestyle before they even get pregnant potentially influence how they experience these minor ailments later on? Something to chew on, perhaps.